is actually go ahead and get started. Welcome everybody to our deep dive about the fundamental skills, a group of apps that we have built that we think really works very well for a lot of the fundamental skill sets that happen in the early year, really the first couple of semesters, first year of PT and PTA programs, OT, OTA programs. And so just as a brief introduction to me, I've been teaching at Azusa Pacific University. I'm an associate professor there for the last 18 years. That's been my home. I'm a teaching and learning fellow as well. So I've spent a lot of time thinking about why is it so hard to turn these young, eager learners into clinicians? I did my orthopedic residency and manual therapy fellowship training through Kaiser in Southern California. I teach at the University of Southern California Spine Fellowship, and we use these apps as a way to implement clinical practice guidelines. And I've spent a lot of these last 7 or 8 years thinking about how digital technology can enhance learning in a very motor skill heavy and clinical pattern based profession. And so what I hope to show you is some of those apps today and how you might want to use it in your early fundamental classes. And lastly, I chair the institutional review board at our university. And I have 2 guests with me. I have Dr. James Syms, who is with me today. He's kind of my wingman on these webinars. Retired 26 years in PT academia, 22 years as a certified athletic trainer, director of ATC and PTA content development. He is actually about to launch a laws and regulations interactive game/course modules that help our students prepare for our board exams, as well as it's an adjunct to our classroom content for laws and regs. Imagine learning about laws and regs through scenarios instead of just reading about laws and regs and studying. I mean, our students asked us, is there a better way to study for this exam?
This is so boring.
This is so boring to just look through these PDFs. So we built scenarios, the common scenarios that they can now apply the laws and regulations and really help it to sink in. So this is something exciting that James has been working on. We are done, James, correct me if I'm wrong. We are done with California, with Texas, with Maine. We've been talking about Nevada coming up next. Is that right, James?
Yeah, not Maine, but Nevada, Nebraska, New Hampshire, Oregon, all those are in some way, shape, getting close to the finish line as we go through there. And so, it's like watching, what bills being passed and sausage being made. You don't want to do that, but I'm kind of a dork. I'm a kind of a closet poli-sci guy. Yeah. So it is fun, Danny, it is fun if you know how to watch. It's like baseball, boring to most people, but those who are baseball folks know it's a very exciting game.
Right.
Yeah.
And, James has served the California PT Association as a past president. And so your poli-sci roots, James,
because you look at served
as well. Just to remind everybody, if you're able to mute yourself, just to double check here. Let me see if I can make sure I mute everybody. Hang on one second. Okay, great. It looks like everybody's muted. Okay, let me move forward then. Good to see you, Elaine. All right. So the other thing I want to good to see you. Yes. The other thing I want to mention is our strategic partnership with JOSPT. So we are filming lots of content to help the journal come to life. We have filmed all of the clinical practice guideline content. There's a new special feature on return to sport for upper extremity that we have just filmed all of the exercises. And so the next generation of learning from journals is going to be really cool. Yeah. You'll never have to wonder, what was that technique? You get to watch it. And so this is something we're excited about. And now we get down to the bones, the meat of today, and that is to talk a little bit about 5 ways to use the PhysioU apps in your online classroom. And I'll take you through a little bit of a tour. It's great to have Dan here. Dan and I have been updating the range of motion MMT app endlessly based on faculty feedback, based on new ideas that we want to have. Yeah. So when we get to that, I'm going to ask Dan to just share a little bit. So here's the range of motion MMT app. This is one of our most popular apps because every program teaches it, and we generally teach it the same way with minor variations. So we started all of our videos here. So let me just take you for a quick glimpse into that for a second here. So here I'm in the PhysioU apps. Now, all of you should have full access to this. All faculty have full access. You can use it to help in your labs as much as you want. Now, here's the range of motion MMT. Here's the shoulder app, the shoulder part. And you can see that there are several sections. Palpation, because that's what we do while the students are in gross anatomy and learning range of motion MMT at the same time. Shoulder will have bony landmarks, anterior, coracoid process, all of these different structures, and a short video of how to palpate it.
When palpating for the coracoid process, the coracoid process is an attachment for the pectoralis muscles. So the best way to palpate is to horizontally adduct the patient so as to put those structures on slack.
So our students, prior to coming to class, have a lab handout where they are instructed to go and watch the videos, practice this on yourself or on someone else. This is something that you can do asynchronously. So we save a lot of our lab time for actually doing the range of motion MMT together. The palpation is all done on their own. So here is just some information about the structure, the cues on how to palpate it, some associated structures. Okay. Of course, this has both bony and soft tissue palpation. So you see that we've separated all of these by kind of the body region and the direction, right? The anterior, posterior side of the shoulder area. And if you move into shoulder range of motion, we have essentially followed the Norkin and White text, as well as the Berryman-Reese text. And then as faculty have asked for more videos because they use different textbooks, we film alternative videos. Right. So inevitably over time, we will have every video that you need. We probably have 90% of the videos that you need already. So there's always an end feel. Here's flexion, a video of how to do the range of motion, instructions. And then at the end, you see goniometer landmarks, normal ranges of motion from the AAOS or AMA, some keys to reliability. Dan's put some thoughts in there about, hey, when you're with real patients, here are some things you need to think about. And then we tried to make a connection, right? It's so easy for the students just to memorize range of motion without making the connection that this range of motion is probably related to the patient's inability to do something in life, whether it's their function or their occupation. So we thought that that's a really nice way to help them bridge the connection. This is not just an isolated skill. This is a glimpse into a potential impairment that is causing functional limitation and disability. So you can see that that is all the shoulder range of motion lab. The students watch all of this before they come to class. They're prepared for lab because they've seen all the techniques before. The other thing, let me show you manual muscle test. Because we're teaching it at the same time as anatomy, we've carefully added the muscles so that they're always thinking about what muscles are making this motion happen. Here is the different grades. If different textbooks have different positions for grades 0 through 2, we have filmed alternatives, and we're here in the green room. What you see right now with Dan and I are our new Prism Workshop PhysioU studio. We've got a white side, a green side, and we've been filming every week for the last, I don't know, it's been.
He's a slave driver.
He's a slave driver because there's a lot of cool things to build. So the other thing I would say is when you look at the manual muscle test, you will see that not only do we use these videos even in class. So because all of our students are currently in pods, we cannot demonstrate the technique to all of them. So we show the video on the screen. And then if there's a particular technique that we want to show, then we actually use Zoom and we do it live. But for the most part, we've run our entire class using the videos from PhysioU, right? There's a consistency in across all the instructors in the different rooms, they're all benchmarked to the video. So that helps us when we get to the practical exams. You guys studied using these videos. We demonstrated techniques using these videos. We're holding you accountable to these videos. So it standardizes things. So here's your instructions. Here are your cues, your grading, as well as the key muscles, your anatomy table. So you can see that we're always trying to build bridges forward and back. Think about what function this relates to. Think about what muscles this relates to and the origin, insertion, and innervation. And then back to occupation and function again. So the next thing I want to show you, oh, actually, let me just take a moment. Does anyone have any questions about this related to this app? This app also has the neuro screen because we introduce it here in our program. So here's the upper quarter neuro screen, dermatomes, myotomes, and reflexes. And our program just standardized to this. Across all of their curriculum, the students start with this, they end with this, and it helps to minimize the confusion as they go across different instructors.
Nothing in the chat so far, Mike.
Okay. Dan, did you want to mention anything about why we built this?
Yeah, I mean, I got to teach. I was very fortunate enough to teach as a clinician. I had a private practice, but I got to teach at USC as an adjunct professor for about 18 years. And I taught in the ortho department. And, you know, when I met Mike, when I came over to Azusa Pacific University and we became friends, I started to see this app and I fell in love with it. I had taught out of Kendall, quite frankly. We had transitioned to Berryman Reese, I believe, at some point in time. And the problem was, and everybody here listening understands, if you've ever been involved with a textbook and putting it together, or even in buying a textbook, the day that we buy it is 2 to 3 years old. Most of the references in it, but that's about the best we can do. And then it's going to stay, you know, for anywhere from 2 to 3 to 4, 5 years before that next edition maybe comes out. So it always was frustrating to me because we were supplementing an awful lot of things with articles and new research. And so even though we had a textbook, we were always having to come up with the new stuff. The thing that's so exciting about really putting together this for PhysioU is that while we, like Mike's told you, we put things in there, we try to validate literally everything. We're not making up tests. We put in everything that's researched, everything that is state of the art, knowing that you will have a little bit of variation or something new will come up next year that changes something in here. The real great thing about this, and the thing I get so excited about, is that we can, like I said, we came in here today and we refilmed some stuff and we thought we could do better. We have a new idea. We can show this better. We can get the students to visualize this better. We're always trying to improve, and we can do it today. I don't have to wait for the next edition to come out. If one of you has a question or an addition or a great idea, we can literally walk in here within 48 hours, within a week of you telling us, film it, get it back to you, and you know, the downtime is just negligible. And so I think this, obviously it's exciting to me as a teacher and an educator, because I feel like I'm state of the art. I am right on top of it with the ability to use this PhysioU, and that is our goal. Actually, is to make it as relevant and as absolutely up to date and as current as everything can possibly be. And that's what we do with really all of the videos and all of the different modules that we put together.
And I remember coming to Dan and saying, Dan, I can't think of anything more painful for students to read about than manual muscle tests and range of motion.
Well, that hasn't changed a lot.
Right. Why don't we film it so that they can watch it and learn from it and carry that resource with them into the clinic? Right. And so the second point I would make here is, if I go back to this, is we've created lab handouts. In fact, we created lab handouts that we're sharing with everybody as well.
Mhm.
So for my orthopedic lab, for the range of motion MMT lab, let me show you where to get it and show you what we mean by we've created that. So if you go to the PhysioU website, okay, so this is the PhysioU website. If you go under educator and under faculty resources, you'll see teaching content. And under teaching content, you'll see lab handouts. So under the lab handouts, you'll see that, oh, here's my range of motion MMT class. Here is shoulder. Here is a Word doc that you can download and edit, or a PDF that's already ready for you. So our students just know, oh, okay, yes, in my syllabus, I need to palpate all these bony and soft tissue structures. I'm going to just follow this handout and click on the link, and it takes me directly to the video. So of course they have to have their own subscription, but all of the videos for lab are already in their pocket. And that's one of the big things that I wanted to share with you, is that one, it makes my life and your life as an educator way easier. All the videos organized and filmed already for you, ready to be deployed. So there is all the labs. You have all these labs. This goes all the way to palpation of soft tissue structures, range of motion MMT, all of it's here. And you can modify it. We've built this for you because we figured most people teach it generally the same. The other thing that I was going to say, so that's what I meant here by augment your labs with high definition video. You can also go into our apps and add our video links to your lab handouts.
Right.
And the way you can do that is here again under teaching content, educator, faculty resources. There's a master video cheat sheet. So if you're teaching range of motion MMT, right? So this is the ortho. This is all 2,000 something techniques in ortho. Here's range of motion MMT right here. And I can just go Control F, shoulder. And now here's all my shoulder palpation, the links that you can embed into your LMS or into your lab handout. And here is the faculty doing that right now, right? So all of this is available to you to augment your own stuff, if that's what you want to do.
Michael, real quick, James. I mentioned in the chat that this is being recorded.
Yes,
and
that's right.
it will be posted on your YouTube page or channel.
Well, you'll be able to.
Or how do you?
Yeah, usually we post. Usually we'll post them here. So if the webinar is done, there will be a YouTube link here, or you can go to the PhysioU YouTube channel and it will be there.
Okay.
Yep. And we're sending this video out to all the registered people as well.
And then that master video cheat sheet, as Dr. Farwell mentioned to me, as new stuff comes out, you don't wait 5 years for a book to come out. It'll be updated there immediately too, I assume, any of your new videos and stuff. So because I know you're already doing that with some stuff. So yeah, that's a neat thing about this app is it's so current.
Yeah. I mean, the nice thing of working with JSPT is we are filming all the current stuff.
Yeah.
Right. So, so that's what I meant here about getting lab videos. Same thing for cardiopalm, same thing for assistive devices. So I'll show you that next. So this is our lab handout in ortho. All of my techniques that I taught this year are all linked to PhysioU videos. I did not have to film anything. There were some lab techniques that I had to do, I had to add in, but that's what we do. That's why we have the studio. The other thing I was going to say is this. Graded exposure for motor skill training is something very powerful that we've realized. And the pandemic really even kind of drilled in that point even more so. The historical way we taught things, and Dan, you and I know, we show and tell on the day of lab.
Yeah.
It's the first time and the last time the students are going to see us demonstrate a technique.
Right.
So by the end of 3 hours, and in my lab, it's 5 hours, it's deers in the headlight. It's deers in, you know.
What was that first technique you showed?
They can't
when we
remember
started?
any of it. They are trying to film it with their own cameras. They're scribbling notes feverishly. By the end of that day, it is a shamble. When in fact, these last few years, we have been using the videos and the apps because the students are asked to preview the techniques and to try the techniques on themselves or others, the simple ones, so that when we actually get to face-to-face class or online class, actually I pull up the PhysioU app and I show the techniques again, and we talk about them in context. So I take the techniques that they've been exposed to and I add meaning to it.
It's one of the, I think it's one of the most powerful things we do, because if you, I mean, I know the way I learned, I was busy either buried taking notes, and then obviously the last few years, everybody shows up with their cameras and tries to record. Either way, they're not listening. They're just trying to make sure that they have some kind of note to go back to. The nice thing here is that we don't have people worried about that anymore.
Nope.
They know they have videos and everything documented. They have the notes. It's all right there. So we have class time really for those discussions, and we can really start to fine tune.
Yeah,
I think
build
what
the
we're looking at.
context.
Yeah.
I think in the past too, I mean, students would go, well, I forgot how to do AdSense tests. I'm gonna go online and look it up online. And it might be a slight variation difference, but,
Oh.
and obviously educators, you guys accept or don't accept a slight variation of technique, how you demonstrate in class for like testing purposes or whatever. But at least this is one standard kind of thing. Hey, here's the foundation, whatever. And if you find a variant, you know, kind of bring it to class, let us know. But you guys will have looked at this ahead of time before you come to lab at least.
Yeah. I mean, there is no replacing face-to-face hands-on practice.
No.
But I think from the perspective of how do I help this information sink in deep? And how do I expand the time, the trickle in time of students being exposed to the techniques, trying the techniques, now officially learning the technique with us in the context of the patterns that we talk about.
Mhm.
And the last thing that we've been doing this year is virtual checkoffs. So all of our TAs have virtual checkoff times with the students for them to demonstrate certain techniques.
Yeah.
All of this comes together. And that's what I mean by graded exposure. Teaching motor skills should not be a one-time event. It should be a multiple exposure event that is of low risk and high quality. And so we had to think this through and define it for our students. Watch before you come, try it out, then we're going to teach you about it officially, and then we're going to practice it together and you're going to get checked off. Think about how many exposures that is. So we've been very pleased to see, even in the pandemic time, how the students have taken to this methodology. And I think it's a good evolution of how we teach motor skills.
Michael,
Yes. Hi, Lee.
Elaine here, hi. And Jim, are y'all gonna go into different areas? For example, neuro, I did not have time, honestly, to look at it, but for example, in the area of PNF,
Mhm.
I mean, that's a little, you know, a little different than maybe even what you're doing here. And I know you're talking about teaching motor skills. So would you have time today to at least take a minute to look at PNF?
Sure.
I'd like to see how you approach.
It's
Yeah.
the same idea.
Okay.
That's a great segue. Let me just take you to the app itself, and I'll also show you the lab handout that we built for it, because PNF is a high level motor skill.
Yeah. Yeah.
And watching it for the first time should not be the way that they learn this. So in the
That's
app,
how I learned it.
right. This is how we all learned it, right? So
Trying to be better.
we're trying to be better. So here's the PNF app. We built this in partnership with Kaiser Vallejo. She is our alumni. She is a faculty member there now. And we decided to build the philosophy videos that the students will watch ahead of time. So before they come to class for the 2 or 3 PNF days,
Right.
they have been pre-exposed to the philosophy. They have been pre-exposed to the basic principles. So all of this is here for asynchronous learning, because it saves you time when you get face-to-face. Then you have explanations of the common techniques. So let me give you an example of that. Let's take a look at something like this. So she gives a little introduction, which is just a narrated PowerPoint, and then there's the video.
Rhythmic initiation. It's going to go through the passive, active assisted, active, and then the independent motion. It could be used for any functional motion. So we're going to use for reaching for the cup. The key to make this successful is your verbal cues have to set the tone and set the pace for the motion. Okay. I'm going to start here. I want you to open your hand Reach for the cup. Good. Do that again. You're gonna open your hand and reach. All right, help me out a little bit. Open the hand and reach. Nice. Help me a little more. Good. Now help me a little more. Nice. Now help me more. Go. Now you do it. Go. Nice. Do it again. Go.
So literally, this can be an adjunct to the things that you're teaching. And this goes all the way into the different patterns, the rolling, the progressions, treatment and sitting, PNF gait, functional application of a lot of these different movements and patterns. So I don't know if that gives you a glimpse of what's in the app. Was there something else you wanted to know?
No, I know you helped me. I mean, I had PNF 5 days a week for a semester at North Carolina, and then I took coursework with Maggie Knott. So
Awesome.
yeah, and I've been teaching PNF for many years. And you're right. I mean, there's so much just for them to get the movement patterns. It's just like,
They need to be able to watch it ahead of time. I think visualization is so important.
No, that's true. And they only get to see it a limited number of times. So this is just, I mean, this would be great. I mean,
Yeah.
I love this. This would be great.
And I think what's really cool here too is we filmed her doing a full eval on a Parkinson's patient. I think it's
Okay.
great. And so you get to watch the subjective, the pre-treatment assessment, the actual application of PNF, the post-treatment reassessment, and the home exercise. How powerful is that in terms of pulling together all of those things that they learned piecemeal and letting them see the big picture?
Oh, and how PNF works.
And how PNF
in a
works.
treatment
Right.
process. Yeah.
So this is very powerful. And just so you know that there is a lab handout for this as well. So if you go back to faculty resources, teaching content, here's your lab handouts, and here's your PNF.
I'm just curious. Go ahead. I'm sorry.
What's that? Go ahead.
I'm just curious. Do you take it? I understand you've shown a patient with Parkinson's disease. Do you actually take it into working with patients that have other disorders? For example, I've always had to fight with students. I was like, well, I don't need it because I'm not going to work with patients with neurological disorders. I'm going to work in ortho. I'm like, oh gosh, really?
Right.
And I'm just curious because
Absolutely.
that's been a fight. I mean, any strengthening, low endurance. I mean,
she
I love the technique.
when we built this app, she particularly wanted to add in this functional application because she wanted to show people that this is related to reaching, this is related to rolling, and so I think some of that connection to functional movement, which is not neuro or ortho, it's human. It's all listed here. And you can utilize this as a way to build that bridge. And as you could see here, the lab handouts are all here for you as well, because this is a fairly predictable way to teach this class. So let me keep moving forward. I hope that helps. And it really ties in very nicely to this idea of graded exposure. Please watch the scapular patterns and the upper extremity patterns before you come to class. Then we are going to talk about them, talk about why you would apply that. And now let's practice again. Take your computers, go watch it, and now practice again. It takes so much pressure off of the faculty and actually extends the window upon which they have these resources to draw on. When they get to clinic, they want to try some type of pattern with a shoulder impingement patient. They just open up the app and it's there.
Right.
Yeah. Here is what we did this year with testing motor skills online. So the students knew that virtual checkoffs was going to be very similar to online testing. So at the end of last year, when the pandemic had just started, we were like, how in the world are we going to test all of these motor skills? Special tests, range of motion, MMT. Well, we basically created a rubric. Every grader, Dan and I, all of us faculty were part of it. And we knew exactly what the students were going to be tested on. We had the answers with us. And we basically had the students perform the techniques that they were supposed to do, it actually worked pretty well. And we're seeing the results of it in ortho this year.
This year
The skills are actually pretty good, surprisingly. And our TAs created a skills grade sheet in Google Sheets. Every student had one that's already created for them. We would just go in, put our points, put our comments, and it would auto score, and they would take that and drop it into our grade book. So it was very efficient. It actually worked fairly well. Thankfully, we won't have to do that for ortho, the end of ortho this year.
Right.
This is some of the students did not have partners to do their exam on. So he said, use anybody, please measure hip flexion. And there she is measuring hip flexion. Isn't that funny? So this year we decided that it's important to help the students take things seriously, but also be a little lighthearted, because they're in a tough position too. It's not just us struggling. They're struggling harder than we are. And so we've, in many ways, we've enjoyed this year with them, as tough as it's been. And yes, it's taken at least 3 of my 9 lives for sure. I mean, it's been a tough year. I wanted to show you about Gate. The Gate app. Gate is usually a part of the fundamental first year.
I think this is one of my favorite parts.
This is one of our favorite apps. I was talking to Chris. He was one of my alumni, brilliant professor. And I said, Chris, I think we can teach human movement better. It does not have to be stick figures and bar graphs. So we said, let's give it a try. The learn phase of Gate. Let me look at the time. Okay, perfect. The learn phase of Gate is always static, and it always has a reference image. So when you're learning about the phase description, you always have a reference image to make sense of what that phase description is saying. And you can always learn about the range of motion for that phase: hip, knee, ankle, the EMG requirements for that phase. This is anterior tib, right when the heel hits the ground. And here's the critical events. This is part of their asynchronous learning. The students know that before they come to class, they are to go through the learn phase, the learn part of the Gate. They study this on their own. Then when we get to class, we go to analyze. In analyze, you have real speed video. You have close up slow motion video. Then you have different views, as well as real-time range of motion. This is actually really fun because we can stop the video at any point and ask the patient, what do you see? What phase of Gate? What is the critical events occurring here? What range of motion do you see the hip in? Think about how interactive Gate. James, you can speak into this as well. I remember as we were building this, and this was a class that you taught, you knew that every time we got to the bars and graphs, there was going to be a pool of drool. The students have fallen asleep.
Yeah, a couple comments. Number one, this is the one where I'd have a nice video for class, and then next year it's off YouTube. It's gone. I mean, and so I never had kind of a consistent pool of audiovisual support or whatever. It's tough to teach something that moves with static pictures, so video is always good, and to synchronize it like that. And so I think that's what's really good about the other thing about this is that range of motion, MMT, basic skills, whatever. This is the one that I like kind of earlier in the curriculum because it really teaches students to do some critical thinking. What do you see and what does that mean? Pull together your anatomy, your biomechanics, your kinese. It's the first, second, third class lever, eccentric, concentric, isometric, whatever. And so it really has them start applying the stuff they've learned in their basic science courses as they go through. And it really is that cognitive processing that allows them to learn how to think that will carry over to the neuro and to the ortho higher level thought processing activities that you have to do as a physical therapist. So I really think that a good Gate mental development kind of techniques for these students is very helpful at this point, and this app really helps. And this is the one that I fell in love with and used it the last 3 years I was teaching.
Yeah, and so you can see that we've taken real patients and we've organized it so that you do not have to search for you through YouTube for videos that may or may not be there anymore.
Right.
They're all filmed in our studio. Here's the associated phase, the potential cause, and the potential penalty. All of these are wonderful conversations about how would you measure that range of motion? What muscle strength? How would you test that muscle strength? What intervention do you think might be relevant? I mean, how rich is that conversation when you talk about gait?
If they have like an anatomical impairment of some sort, like a nerve's out, you expect a foot drop, or you expect a Trendelenburg, or things like that. And then I know it's gait, but you can also then say the same thing with brachial plexus. If there's a lesion somewhere on the brachial plexus, what movements would they expect? So that same thinking, even though it's not gait anymore, it's upper extremity, they still have that kind of thought process to go through the algorithm in their head to learn how to think through things.
Right. And in this app also, we have prosthetic deviations, transfemoral and transtibial.
Which is huge.
Which this, I mean, this is a professor who actually came in and he said, which gait deviation do you want to do? He would take the battery out of his leg. He would tighten up a joint.
Yeah.
It was amazing to watch. And so you have all these prosthetic gait deviations available as well. Lastly, from an interactive standpoint, we have built a bunch of case studies. So there's nothing more powerful than taking a newly found skill for the students and applying it in a simple clinical setting. So here's your 20-year-old female with severe right tibial pain. She has medial tibial stress syndrome. This is her gait analysis that their students are going to do. And then here's a very basic exposure to what we would probably gather in a orthopedic exam. Chief complaint, some past medical history, some aggravating factors, right? They may not know very much, but I think they can sort it out.
Mhm.
And then there are some key clinical reasoning questions that the students will go into Zoom breakout rooms and discuss. The faculty member will then preview all the answers. I tell the students, don't look at the answers. This is time for you to develop your clinical reasoning. And we can just talk. When they come, all the groups come out, I can ask them about different things that they talked about, and then I can open up the answer and make a discussion with them. So you have a bunch of different cases, all the way from people with back pain, people with plantar fasciitis, people with turf toe. This is a football player. We have prosthetic gait problems as well. So here's your transfemoral amputee with low back pain. What do you see? What's going on? So again, think about how far we can evolve how gait is taught and integrated into a clinical mindset.
Yeah, I mean, the key thing is, and all of you know this if you've gone to continuing education courses and stuff, I've sat there in foot courses and, my entire career, and you watch the expert clinician tell you, can you see that? Can you see that? And you're sitting there with 20, 30 people going, man, I do not see that. It is amazing to be able to have, I think, something to this that you can sit and watch, because you get better at observational gait the more you look at gait.
Absolutely.
And this app is just unbelievable in letting people actually see and guide them into what their eyes are supposed to be looking at. And I have improved, and I'm an old dude, and I can't tell you how much in just working through this. I teach prosthetics and orthotics, and it's just critical. Gait is literally the number one thing as physical therapists that we deal with in a prosthetic environment. And so to be able to look at these patients and just really analyze the gait and have discussions with prosthetists and be educated in what I'm looking at and what I'm seeing, be able to explain it to them, amazing. Just incredibly, it's a gift.
So that's how we've used this in our class for gait. They learn it on their own in the learn phase, right? Here's the learn phase, everything's static. And then we analyze things together. And then we do case studies to make it clinically appropriate, clinically interesting, right? Relevant. The two other apps I wanted to show you that are very much tied to first year and are really difficult to teach. I mean, I taught modalities for about 12 of my 17 years, or 10 of my 17 years, 18 years. And I love having these videos that my students can watch ahead of time. So for all of you who are teaching physical agents and trying to do that online, think about how that went this year. This past summer, I had filmed many of these videos 3 years ago. We just never got around to it until everyone started saying, do you have anything for physical agents? Because how are we going to teach that without meeting in lab and having to share all the equipment? So we filmed all of it. So here's your mechanical traction. Here is cervical traction, the purpose, all the references. Okay. Here is the contraindications and precautions. What is the contraindication and how should you ask your patient? So the contraindications and precautions are there. Here is how to set them up. So the instructions, step by step, the video. First, prepare the traction table. Attach the cervical traction unit to the main device. Adjust the height of the table to an optimal height. You can have the students watch this on their own. And when you're in class, you can actually play the high-speed video, which is silent and half the time. So you can see all of it in 1 minute and 15 seconds. So you can stop the video at any point and talk about different things that you want to talk about as an instructor. Right. The other thing is we've added the photo gallery. So you don't even have to watch the video if you don't want. You can just clip through the video. Lots of the students, after they watch it the first time, they just use the high-speed video or the gallery just to refresh before they go and practice. The other thing that I would show you is that there's a patient education piece that we've written. Our students always read this so that they know in layman's terms what to tell patients. Why do we use it? What does it feel like? How do I do this at home? Oh, here's towel traction, right? How often should I do this? When should I avoid this type of treatment? They read this and learn this on their own, but they also use this and share it with their patients. So you just send it by email. And the patient will get a patient education piece. So we've begun to create a lot of these different patient education pieces. So essentially with this app, you have phonophoresis, ultrasound, compression. Oops, let me go back to here, try later. Electrotherapy, HVPC, IFC, Ionto, TENS, NMES for quads, shoulder abduction, thumb abduction, wrist extension. All of the videos are there.
Michael, patient education is not unique to therapeutic agents. You have it embedded in most of the apps.
We have it embedded in a lot of apps. Yeah.
Okay.
Yeah.
And then there's a question about, you have cases on the web with neuromuscular or developmental disorders for children in terms of, I'm assuming gait is from, Elaine asked that.
There are some cases. I will show you that in 1 second. I will just go to show you that every single one
As time
of them
permits.
have case upper quarter and case lower quarter. So a very simple, here's a tennis elbow patient. Here's a very simple vignette because this is a year 1 class. They haven't learned a lot yet. Right. And now what modality is indicated? What kind of diagnosis may be appropriate for this modality, right? So this is some common diagnoses. What are some precautions and contraindications? The students go into their Zoom breakout room to discuss this, right? Verbalize how you would screen the patient. Here's the questions for contras and precautions. So there's a lot of, I think, case-based repetition so that things can soak in. So that's physical agents. We also have lab handouts for that. So under teaching content, lab handouts, here's your physical agents lab handouts. All of the key lab handouts that you need and that you can modify, and they're linked directly to the videos, right? They can watch it that way. Another app Similar, first year class, the instructors came to me and said, Mike, our students hate reading about assistive devices. Could we just make videos of all the gait patterns with all the assistive devices? So here you have videos that they watch ahead of time before they come to lab. Guys, we're going to try out a bunch of assistive devices. Please watch the fitting video on your own and know that you can also share this page with your patient one day. So this is how you fit crutches. And by the way, we're going to learn a bunch of gait patterns. Please watch these videos before you come to class, because when we get to class, we have the equipment. I want you to start practicing. You have the videos. So we filmed it. Here's modified 3-point gait, the indications, why you would use it, the different devices, and we filmed it for both right and left lower extremities.
For modified 3-point gait, with the right leg affected, have the patient first bring the crutches forward, then the right leg, and finally step through with the left leg. Continue with this pattern: crutches, right leg, left leg. Crutches, right leg, left leg.
The students watch this. They share this with their patients. They share with their patients how to get up and down stairs. So if I take you back here to this app, stair training, crutches, right extremity, non-weight bearing. Here's how you go up. Here's how you go down. The students watch it before class. We try it out when we get to class. The lab can almost run itself. The students now really get to spend time having you weave the context, weave the story, and then they go and practice on their own. The resource is in their pocket. It's on their phone, their iPad, or their laptop. Let me get rid of this. Okay. In this app, we visit bed mobility, basic bed mobility. Now, granted, there are nuances in how people like to do this. This is a very basic form. You can add your extra thoughts on top of what we've filmed here. There is also sit to stand and stand to sit with the various assistive devices and with the various limbs, right or left lower extremity, as well as transfers and wheelchair. How to educate the patient, how to fit the patient, the components of the wheelchair, propulsion and mobility, going up and down curbs. Here's wheelchairs again, and pressure relief, various forms of pressure relief.
No, I think the key thing with a lot of this is, Mike, that it's the very, very standard stuff.
It's the standard stuff.
It's like everything that we're showing. I don't think we're going to get any disagreement or any kind of discussion with, and we do that on purpose because we understand that exactly all the faculty out there are going to have some caveats that they'd like to focus on or different particular things. And so I think this app, is very, very applicable because it gives you the foundational stuff and then lets you add anything that you want to,
right,
to make it yours.
And then again, here are your interactive case studies. Students can go into the breakout rooms. Here's a very simple case. Based on the information above, what type of assisted device would you recommend? Right, so there's all these little quick ways that make it easy for you to not have to generate these cases. They're generic, they're simple. They're just there to create context to help the learning sink in deeper. Any comments or questions so far, James, as I finish up here?
I haven't seen any in the chat, but I also invite people to unmute themselves and ask Mike the question. But if you're not comfortable doing that, you can put in the chat and then it'll keep Mike's flow going too.
Yeah.
And also he may get to it later, so we'll defer it.
Okay. Yeah, we will have a few minutes right at the end. I'm pretty close to done here. This is a collaboration between PhysioU and University of Idaho. We also worked with Dr. Edie Kendall out of Plymouth, and she basically had begun to capture some children with neurologic dysfunction, as well as some models that did not have neurologic dysfunction, but we turned it into a virtual reality setting. Okay, so we just released this. Let me show it to you. Here in the apps, the students are now able, let me see, it should be right here, Pediatric Gait VR. Okay, the students are now able to apply their movement analysis that they learned in gait to subjects. So here's me, select a patient, Sarah. And Sarah, 8-year-old girl diagnosed with right spastic hemiplegic cerebral palsy. Okay, so now I'm going to go through and fill out this Edinburgh visual gait score. So initial contact in space, I'm going to have her start going here. Initial contact in stance looks like toe first contact. Good, and moving on. Heel lift in stance. Okay, no heel contact. When the student finishes this, there's a key that helps them to learn what they saw and what they got wrong. You can rotate around the patient. You can stop, put a posture grid on. You can add a goniometer. You can change the height that you're looking at. And you can try a number of different patients. It's just another way to help the students step up to the next level of applying what they learned in gait to these different patient populations. Okay, so this is the virtual reality gait app. And the last app I was going to talk about, it may be considered fundamental skills. It may be considered an advanced skill. I think it's usually later in the curriculum, is our pharmacology app. So even when I'm with mentoring residents and fellows, I'm like, man, I can't remember this particular medication. I wish I had a resource that I could go to that would help me figure out some rehab implications related to these medical.
The new Merck manual.
It's the new Merck manual, but this is rehab specific.
Yeah.
So what I want you to see here is we recently released the pharmacology app. She is a she did her residency. They have residencies for pharmacists at USC. She's now working at Kaiser, and she works closely with us rehab specialists to create the A to Z pharmacology app. Yeah. Right? So here's the drugs A to Z. You can search it alphabetically. Here is the drugs by class or category. Okay, so here we have some pain or rheumatologic medications. And you can also look at the different class adverse reactions. So you could look at the common classes, antidepressants, SSRIs. Here are some of the common adverse reactions, and you can click for more details related to these medications. Or you could just search. You can say ibuprofen. Many of our patients are taking that. Here's ibuprofen, common US brand names, pharmacologic category, adverse reactions that are common or serious, and some rehab implications. And we didn't do that for all the medications. We chose very common medications that we'll see in the clinic, and we created implications for rehab there.
Yeah.
One step that we are working with, so there's a few DCEs who've come to us and who've said, hey, I created worksheets for my students so that when they're in the clinic, they can reference your app, reference other pharmacologic resources to help them really integrate pharmacology while they're in the clinic. And so what we did was we modified those Here under teaching content, again, you see the lab handouts. Here's the pharmacology clinical worksheets. So here is a pharmacology assessment template. They choose one patient a week. Please fill out the medications that the patient's on. What is the generic name? What's the class? What's the dosage that the patient's on? And what has the patient been taking it? And so we can begin to get a sense, are there any adherence issues? What did you do about those adherence issues? Little ways to integrate this. So you could use this pharmacology assessment template, or you could also use this medication review table. It's a very similar concept. One patient a week. Please put down the medications that they're on. What are the precautions, side effects, potential disease interactions? Some of this you're going to have to get from other resources. We've kept it very clean, which is what are the common side effects that you have to be worried about? And you can click directly into the pharmacology app and start looking up medications. So we tried to make it clinical as well.
Right.
You used it in your class. Now we want you to use it in a clinical setting. And as they begin to sort through the medication that patients are on, they begin to see the patterns and understand quickly how the pharmacology or the medications can affect the rehab process. So I think in closing, so that was my last point there. In closing, I think what I want to say, and I know it's noon, is that we've created a lot of apps.
For us.
Noon for us, yeah. We've created a lot of apps that we hope will make learning easier for your students, but it will also make teaching easier for you as faculty.
Right.
So I'd just like to open it up right now if anybody has any questions or thoughts or comments. Any comments or thoughts? James, any comments? Yeah, feel free to unmute yourself. Both Dan and I are here. James and I are here.
Yeah, I think the thing about this app is what I found it, and I was introduced to it just as a educator, not as a kind of a staff person with PhysioU, is it's not just a repository of information. I mean, they can go online and get the books or whatever there. It actually, and you walk through it with that graded exposure, testing motor skill, you kind of gave a process by which the students can mature and start developing how they think through patient problems and patient. And that's why I love that clinical reasoning is what it goes. And the consistency with the app, they've seen it in MMT, range of motion. So you're teaching gait, go back, what's normal range of the ankle?
Right.
What muscles
I do that
it?
all the time.
And,
I just open the app.
Yeah.
And I say, hey, we're in ortho right now, but this patient could really benefit from a modality. Which modality would you have used? What are the settings for that? What are the contraindications, precautions? I personally can't remember all of them, but I just open up the app, take them there, and you can go so deep across the curriculum and really make that integration.
Yeah. And I know that, and I was very cognizant when I was an educator to know what classes they had prior to me that I can say, you've had this, let's bring it back up to the front burner and use it now. That's why you learned it, and it's not learn and burn. And it helps you remember it more. And maybe I'll invite any of the folks the participants are still on the call, those who have been using it or have used it. What have you found of help, and what have you found would be more helpful if it had a different kind of tweak to it? Maybe you guys, those folks who are on the call who already are using it, can share that.
Yeah. Any comments from the group? Please feel free to unmute yourself.
I just have a question. To get to YouTube, is there a direct link, or do you have to just go out? You
to our
talked about
YouTube channel.
To YouTube channel. So do you have a
you
direct?
just type PhysioU. You just type PhysioU. But yeah, if you just type PhysioU in YouTube, you'll see all of our little webinars, things like that.
Okay.
Yeah. And for those of you who are continuing to be interested, there are on our website under faculty resources, there's more deep dive webinars coming up, but there's also pre-recorded deep dive webinars. about different topic areas, neuro and peds, early foundation courses. Of course, this is updated now and we'll replace it with this one. Cardiopulmonary acute care, how to use our apps in ortho or musculoskeletal care. I would just say that Dan and I, this last week, we filmed all the arthrokinematics.
Yeah.
It was really fun. Every body region, every movement, we filmed arthrokinematics so that students can visualize it. This morning, Dan and I are filming all the joint mobs that we teach in ortho. You're not going to see it just as a clinician doing it on a patient. You're going to see the PT doing it on a skeleton. So that you can flip the different views to help the students really integrate it better. That's what we do. We meet on a Thursday and we sit here and dream about what are the things I wish I had, or that I have to pull a skeleton over to show things and everyone's crowding around. Now they just flip to it in their PhysioU.
I always thought it'd be fun, Dan, and you appreciate this with extremity joint mobile, to actually do a joint mobile on a shoulder and have like a dynamic MRI showing the humeral head gliding.
Right.
Yeah.
So look at that, millimeters of movement or something. It'd be cool if that can happen, but
Yeah, well, we're doing it on the skeleton in lieu of
Right.
that.
Yeah.
right.
You know,
And
today we shot spinal mechanics. So we just basically zoomed in on the facets and showed up glide, down glides, rotations, exactly what's happening at the facets. But
I remember some old research done where they actually took cadavers and put like Indian ink on the joint, put it back together, and they mobbed it and took it out, and they could see on the Indian ink, where the Indian ink kind of scribed on the concave surface and stuff. It was pretty cool to see that. And back in the 50s.
Yeah, I mean, I would just say this is an example of what we filmed last week. So the student gets a sense of the human movement as well as what's going on at the spine.
Arthrokinetically, yeah.
Yeah.
There's a question,
So
when will these be out? I want it now. Do me a favor and do it for me now.
yes. So I'll tell you, it's funny.
get on it.
Get on it.
Our guy who's doing, come on, they want it now. You
Yeah,
need to get this stuff uploaded.
It will be out by fall for sure, because we are done filming arthrokinematics. We finished today. We have to edit it and then we have to add it into the app. It will be out by summer for sure.
Yeah,
So
great
it's
question,
all the stuff
Regina.
we've always wanted. Yeah, great question, Regina.
Yeah.
Other comments, thoughts, things that you wish we had that we could build for you?
I was going to say one of the things I teach an advanced patient management course. I think somebody else had said there's different names that we have that, but it's basically for our third year students where it's much more complex patient. But we utilize PhysioU is one of the key factors that I'm using in that program right now, because it is multifactorial problems. We're looking at orthopedic problems with a person with diabetes, or we're looking at cardiopulmonary problems and neuro problems. And so it's multiple apps that are actually applicable to this. And you can it's so easy to just flow in and out in the evaluation of a really more advanced type of patient.
Right. I mean, I know Tony Okawa, who's joined us here from Toro in Nevada, Vegas, uses it for that exact same reason. I mean, part of the reason why we, in the cardiopulmonary app, we built the cases to actually potentially have some orthopedic component. I mean, the person has leg pain, they could have peripheral vascular disease, but they are at the same age that they could also have spinal stenosis. It hurts when they walk. And so those cases were designed for these kind of multiple systems, kind of integrative thinking.
Or like a differential diagnosis course.
Yeah,
as well.
exactly.
So it's
I have
awesome.
kind of an at-large question again, and I'll offer it to the participants, that those who use it, do they use it just in that one course? Because I do PNF or range of motion MMT. Second part is, do other folks use it? And do you find a benefit if the entire program would use it, not as gospel, but as a very good learning augmentation, that now your whole curriculum knows what the left hand is doing and the right hand is doing and such like that? And is there any pushback? Well, I've been teaching my class for 20 years. I don't need to change it type stuff. I don't know if that occurs at all. And that's okay, I guess. But I'm wondering if those questions can be answered by those who are using it. And maybe don't want to offer it online, but sometime later share that.
Yeah, I'll share. This is Manny Young.
Hi, Manny.
Hi, everybody. So yeah,
our program, for me at least, we've been using it for our orthopedic content advanced class, and the template has pretty much all the links and the picture of the different techniques, and the students love it. And they're like, how come we don't get the apps, early on, like with our neuro content or with our, multiple medical complex, curriculum and stuff like that. So this semester, we've been using it for a few years now. So I think for the first time this year, the faculty were so surprised at the grades in the exam, both the written and the practical across all three classes for this semester is like really obviously very different. It's improved quite a bit.
Wow.
So I think that speaks of the value of really having multiple repetitions, the graded exposure of the different techniques. They can see it while practicing after I instruct it in lab, and then they practice, and then they click on the video again as they practice. So
yeah, and in full disclosure, I mean, Manny is part of the building of these apps.
Yeah.
I mean, 7 years ago, I said, Manny, I think we need to build this because my students can't sort out all these pieces that I'm putting on the table. Could we build a roadmap for all of these orthopedic conditions and connect prevalence to movement faults, to examination and treatment and therapeutic exercises and modalities? Could we connect all those dots? And so it took us a year to build one app, low back pain. But what has shown me is that students value seeing the big picture. They want to see the roadmap so that they can make sense of all the stops along the way. But usually what we do is we throw all the stops on the table. These are all the examination and treatment techniques you need for the shoulder.
Yeah.
And then you're going to pull it together when you get into the clinic. Well, we know that that doesn't work out very well. So preemptively in my teaching, we always have the students walk themselves through these apps on their own using a guided worksheet. So what I mean by that is here, again, under teaching content, here is the clinical pattern recognition worksheets. When we're talking about shoulder problems, they know that they're going to walk their way through subacromial pain syndrome. They're going to fill out this worksheet and click on the links and learn about what this patient pattern looks like, and learn about what we're going to use in the physical exam. What are some common movement faults that these patients have? What are some common associated impairments like thoracic mobility deficits, weakness of the rotator cuff, whatever it may be? They walk themselves through the entire pattern in preparation for me to do it again when we are synchronous online or face-to-face. I get to use the app and how they have created their own scaffold. I get to build and improve the resolution of their clinical patterns. Before we even get to lab, all of that pre-work is done because it makes lab so much more powerful, right? All of us know how crazy it is to try to give meaning to this stuff after you've dumped it all on the table.
The other thing that's good for this app too is that when they go to the various clinical rotations and they finally leave if they're ever in the academic setting, now it's all virtual, but hopefully they'll get back. They go like, I haven't had ortho for like 12 months. It was first the clinical series. Now I'm doing my ortho rotation. Shoot, is Adson's head rotate toward or head, away from the, they can look it up real quick. It's quick reference them. It's in their pocket on their phone or whatever. The other thing is that this is I think this is the first study guide they should be using to study for the NPTE once they do graduate. And we're working on the laws and regs app for the other part of the 2 tests that most jurisdictions have them take. So I think that it's very helpful for them to very quick. They don't have to go, oh, I left my ortho binder back in California. I'm in, Arizona doing my rotation, but I didn't bring my ortho stuff. I didn't know that there was so much ortho stuff with my neuro folks. Boy, I wish I had my ortho binder or text with me. Well, you have it. It's on this app.
Right. Any other comments or questions? I mean, this is really just an open time for faculty. And I would also just say, if there's ever any of you who would like to meet with me, just schedule a short meeting to chat out some of your ideas. I do that regularly. I enjoy thinking through how you run your curriculum and how these apps can be integrated into your class. So yeah, any thoughts, questions or comments from what you've seen here? Thanks, Manny. Any thoughts, Beverly or Karen, Gail?
Hey, Mike, I'll ask a question.
Hi,
Thanks
Tony.
yeah, I'm excited to use the lines and tubes and the pharmacology portion for that multiple systems course that you mentioned, because I think that will be a big addition to them, helping them out with all the multiple system stuff.
Yep.
I think my question is in regards to what I really love the idea of the patient language instruction in some of the apps. I haven't used that. Can you remind me which applications do have that? Just because I think that's a wonderful implementation to give them some examples of using patient language.
So for example, there's several apps that have it for all of the clinical orthopedic conditions like frozen shoulder. Okay, let's take that for example.
Okay.
Here's all diagnoses: adhesive capsulitis, frozen shoulder. Under the interventions, there's patient education.
Okay, it's there. Got
The
it.
students are taught that one, here's the recommendation for education related to the clinical practice guidelines. Two, we have linked through our partnership with JSPT. Here's the patient perspective directly from the journal. So you can click on that and share that with the patient. Okay, so that's there.
Okay, I remember that. Yep.
The other thing is we've asked our students to always answer at the end of their eval 4 main questions. What's going on? How long is this going to take? Well, this is different stages of frozen shoulder. What are we going to do during your care? So they understand why I'm coming to PT and what I'm going to do, and how you can help yourself. These are all generally written from the clinician speaking to the patient in layman's terms. Our students study all of this. We listen to them every time they do the mentored evals like we did yesterday. Their job to land that plane is to do these 4 questions at the very least. So they have a starting point. It's like sourdough starter, right? You can embellish, but here you always have the roots of what you know patients want to know and what you need to say. So the Ortho app has that. The lines, actually the splinting app also has, here's the different conditions: thumb condition, CMC arthritis. Here's how you build that splint. And here is the patient education. Why do I have this? How do I take care of it? What should I watch out for? We email that to the patient, but the students all read this and learn this as part of their elevator pitch, right? So the Ortho app, the splinting app, the modalities app has the same thing. Like, you know that when you're going to use cryotherapy with a patient, you're going to send them home with some patient education. Well, here's a 1 to 2 minute read of why we use it. So that's my student telling the patient, this is what we use it for. This is what it should feel like: burning, aching, numbness, right? Intense cold IBAN. How do I do this at home? Here's your notes on how to do it. So the student is very well equipped to do patient education because we have intentionally made this a part of their education and given them the roots upon which they can build their clinical practice, right? So those are three main examples. And of course, there's the patient education app where one of our residents went and wrote patient-specific language. It's a 4-minute read about frozen shoulder with some basic exercises that they can do to help themselves. So here are some basic exercises. So our students know that.
I think maybe that's what I was looking for.
Yeah, whenever they have a frozen shoulder patient, they know that they're going to finish their eval by sharing this page to the patient because it extends the window of care. So I hope that's useful. Yeah, Tony.
So what I'm seeing you recap here is it's organized by clinical pattern, so to speak. And
Yes.
what I was curious was I was playing around with the exercise patterns tab down there.
Yep. We just released that 3 days.
Yeah,
2
that's
days
super
ago.
cool. Is that going to also have patient education verbiage at some point, or maybe be linked into the clinical pattern somehow? That'd be pretty cool. Or is that intended to be kind of like more of a regional concept?
Yeah, this is the main guideline-based conditions and the common exercises that you would use for them.
Okay, by guidelines. Okay.
By guidelines, yeah. So they're the most common guideline-based conditions. This is Joe Godges and his work. And so he purposely created these quick access related to the clinical patterns. But I think the cool part about this, and we released it recently, the cool part about this is the post-op patterns. So now what we did was we looked at a number of really well-respected protocols and we organized them all the same. So if you go into rotator cuff repair, you can learn about the surgery. You can give patient education. So we send this to the patient, right? Why do I hurt? How do I reduce my pain? How do I protect my surgery? All of that is written already for the patient. And then you can go to the protocol. Here's an overview of the entire protocol phase by phase. Oh, I'm in phase 1. What problems do I have? Pain and swelling. What should I do? Cold or ice packs. Great. That takes me to the PhysioU.
Okay, cool.
And so we've now begun to integrate all of that together. I mean, Dan, you haven't even seen this yet.
No, this is new.
You know, and you could go directly into a different phase. Here are the different phases. Here's the education for that phase. What are the goals for this phase? What can I do to help myself at this phase of my rehab? So the patient education is specific to each phase because they transition. Right now we're working with resistance. And here's the protocol: early strengthening, typical timeframes. Here's the goals for this phase, the problems related to this phase: loss of rotator cuff strength, click for interventions. Here are some common exercises. So a lot of these exercises will be hyperlinked. We are working on that. Right now, we have all the exercises filmed already. We are just actually beta testing this and getting some feedback from faculty. So all of your common surgeries are all here by body region.
By body region.
One place.
Cool.
Isn't that kind of cool?
Super cool.
Hey, Mike, there's a couple chat comments I can respond to real quick, and that is who is it? Let me scroll back up. It went down. Karen, yeah, Karen, about the PTA program early on, the education leadership meeting, Mike, we're at, and was at Jacksonville, I think. Yeah, we had 2 PTA programs in Florida, said that we were able to combine or eliminate 2 or 3 textbooks because of the app. So, Karen, I think it can help, especially if there are some students in PTA programs who come from I'm about ready to sneeze. Sorry. Who come from lower. Sorry about that, guys. Yeah, and and that's why they're going through the PTA program, not the PT, because they can't have the time or money to spend on a PT doctoral degree. And then, are there any plans for upgrading the integumentary content? And they noticed that you keep doing the updates on the neuro stuff.
In terms of burns and wound care, it's on my list. My intention actually for burns and wound care is actually to make games. I think the content is being delivered reasonably well. It's the integration of the content that just doesn't happen. And that's why the scores are so low on the NPPD. So there are certain things that are really useful to have apps for. And there are certain things that it's really useful to have simulations for. And that's one thing I would just say for those of you who are still around. We have spent a lot of time this year building lots of integrative simulations, interactive evaluations. I mean, part of the reason why I have the studio is this year we have scheduled 8 different neuro patients to come in. Right. And they are going to do full evaluations with PT, OT, and speech so that you can see the integration, the interprofessional management of these patients. And these will become mini games as well as interactive evaluations. You won't know what that means yet, but we are building them as we speak. And it will take learning up another notch. In terms of cost savings for the students, we have slowly eliminated certain textbooks that were really hard for students to learn from. And some of these apps really could replace those. And some of these apps, I think, are just adjuncts to really good textbooks. I mean, there's nothing against textbooks. It's really just, I wanted to build the things that the textbooks couldn't do well. And that's really what PhysioU is focused on doing. And in some cases, it will reduce the cost. You eliminate 3 textbooks, that's $300. Yeah. That's 10 years of PhysioU. I mean, right now the apps are $54 a year. That's less than a grande mocha from Starbucks. So
in our neck of the woods, it is.
right. Yeah. Any other thoughts or comments? And I'm thankful for those of you who are still here. Any other thoughts or comments? Barbara, any thoughts? Well, I want to thank you then all. This video of this recording will be available. We'll actually share it to all of you, and you can share it to any of your colleagues. Know that we have some webinars that are also coming up. If you go to our website, you will see that under faculty resources. So if I go to PhysioU.health or PhysioU.com, either one, and I go to faculty resources, you will see that we have other webinars coming up. April 6th, this is a general webinar, an overview of all the apps. April 22, we'll talk about neurology and peds and how we're using it in our classroom. So look forward to connecting with you. You can feel free to email me anytime, mike@physiou.com. And again, thank you so much for spending the time to learn about this resource, and we hope that it comes in handy for you. Each of you should have full access. If you don't have access, please feel free to email us. Email myself, mike@physiou.com, or care@physiou.com, CARE, and we'll get you set up. All right, everybody. Thank you so much. Thank you, James. Thank you, Dan, for being part of it. And we're back to filming, lunch and filming.
All right, back to work.
Back to work. Take care, everybody.